Thank you, Madam Chair. And Mr. Attorney General, welcome. Let me start off by stating what you already know, that the United States is the only major country on earth not to guarantee health care to all people. Today, some 90 million Americans are either uninsured or underinsured. And despite that, we are spending twice as much per capita on health care as do the people of any other nation. And on top of that, we pay by far the highest prices in the world for prescription drugs, resulting in 1 out of 4 Americans not being able to afford the medicine that they need. So my first question is, what are you going to do, if confirmed, to move this country forward to provide health care to all people and also substantially lower the cost of prescription drugs?
Senator, thank you very much for the question and for your tireless commitment to making sure all people in this country have health care. I believe President Biden made it very clear. If we work hard to build on the Affordable Care Act, and if we continue to make improvements, we will get to that point where we will finally, as the leading nation in the world, be able to say that we truly do cover all of our people. No one should have to experience what I saw as a child when my mom was whisked away to the hospital, not knowing if they'll be able to afford the care. And I believe that we are moving in that direction, and President Biden is committed. He has said, without mistake, that we are going to build on the Affordable Care Act, and that is what I hope to do. And in that regard, Senator, I have to mention that I think there is unanimity, bipartisan support for tackling the high cost of prescription medication. And I can assure you that that will be one of my priorities, is to deal with it swiftly. I've tried to tackle it as the Attorney General. I try to work on that when I was in the House, and I look forward to working with you and members of this body in the future.
Could you give us any more specificity as to how we lower the cost of prescription drugs? Because the truth is, members of Congress have been talking about this issue for decades. And yet the pharmaceutical industry is enormously powerful. They make huge amounts of campaign contributions, spend billions over years on lobbying. They don't often lose. And they continue to be in a position where they can charge Americans any price they want. In case of insulin, for example, we pay 10 times more than our neighbors in Canada do because we have no regulations over them. Can you give us a little bit more specificity as to how we take on the drug companies and lower prescription drug costs?
I think, Senator, we can all agree that the price that we're paying for some of these prescription drugs is far higher than it should be. All you have to do is travel to another country, whether Canada or another country in the world, to find that we're paying way more than some of these, the people in some of these countries are paying. And I took on a number of the pharmaceutical companies, the drug makers, by trying to go behind the curtain of how they reach their pricing. And we were able to prove that there is collusion at times going on. There's a process called pay for delay, where companies will essentially collude with each other to not have a second company put a generic product on the market to compete with the brand name product, and therefore keeping the price of that brand name pharmaceutical product high. We were able to succeed in going behind that curtain and trying to undercut that type of antitrust activity. We can also make sure.
Let me just jump in. Mr. Attorney General, in the midst of a dysfunctional healthcare system, our primary healthcare system is awful in the sense that many, many millions of people, even those with insurance, can't find a medical home, can't find a doctor when they need to. Are you supportive of a significant growth in federally qualified community health centers around this country so that we can make sure that every American, regardless of income, has access to decent quality health care?
Senator, absolutely. That is one of the ways that we were able to reduce by almost 1/2 the uninsured rate in my former congressional district after the implementation of the Affordable Care Act, because our community health centers were there to be supportive of people who didn't have access to hospitals and doctors previously.
Well, in a similar vein, we have a crisis in that we do not have enough healthcare providers, doctors, nurses, others in underserved areas, whether they're urban or rural. Are you supportive of expanding the National Health Service Corps?
Absolutely as well. And here I want to thank the work that you and the members of Congress have done to increase the number of graduate medical education slots by about 1,000 that will be available throughout the country, so we can place these future doctors in places where they're needed most, in some of our rural communities, in some of our inner city communities, making sure that we're meeting the need of people moving forward.
We recently learned some shocking information that life expectancy in the United States as a result of COVID has gone down. For the African American community, it is unbelievable in terms of what we're talking about, because averaging 2.7 years decline. What can we do to make sure that we improve access to minority healthcare access to minority communities in this country?
Senator, as you know, I've worked a long time on these issues, oftentimes with you and others who believe that we should not have the gaps in our healthcare system, that we miss far too many communities too often. And what I can tell you is that if we collect better data that helps us understand where the shortages are, who we're missing, we'll also be able to then provide better treatment. And so first thing is we need to make a better effort at collecting the data that we need. I do want to thank the scientists and experts who made sure that when we're doing the studies for the search of a vaccine, the studies did include some of these oftentimes forgotten communities in their trials. We also have to make sure that we are reaching out. And sometimes the best way to reach out to some of these communities is use the local, civic, religious leaders that are trusted in that community, so we can make sure we're not missing anyone. And so I look forward to working with all of you on numerous
Madam
ways
Chair,
to try to
thank you
make sure
very much.
that we deal with health disparities.